you miss me on that as well? Okay, then here for the intro. Again, my apologies. We do have two interpretation channels here, the American Sign Language interpretation channel and the Spanish interpretation channel, which you can access along the bottom of the console there. We have that gray slider bar that can help you customize your view, and we suggest using gallery view as well for the best experience. Our presenters today, Director Scott Bookman, COVID-19 Incident Commander, and Dr. Rachel Herlihy, State Epidemiologist. Dr. Herlihy, we'll get started with you.
All right, good morning, everyone. Thank you so much for joining us. As I usually do, I'm going to provide you a quick update on our epidemiologic trends in the state with regard to COVID-19, and then also share some of the latest modeling work with you. We have some new projections from our modeling team and estimates of level of immunity in the state that I will be sharing with you. All right, but starting here with our case trends. So you can see that we continue to see this steady decline in the number of cases occurring here in Colorado. That red line shows you our 7-day moving average number of cases, which is now just below 1,500, 1,499 cases is our 7-day moving average. If you follow that left across the figure here, you can see that it has been many months actually since we've been to a case level that low. So certainly continuing to feel optimistic about these trends that we are seeing in the state with regard to cases here. And then if we go to the next slide. Additional good news, as we look at our percent positivity data, we continue to see a clear drop in percent positivity here. You can see that our 7-day average value right now is just below 7% at 6.88%. Again, a very steady decline in percent positivity, getting us back to levels that were seen in more like the August, September timeframe of last year. Next slide, please. Similar good news when it comes to hospitalization numbers. We continue to see a clear decrease in the number of hospitalizations with COVID-19 in the state right now, down to 641 as of yesterday. And I will show you some modeling data in just a minute that shows us that our modeling team does anticipate these numbers will continue to come down over the next couple of weeks and get us back to some of those summer baseline levels from last year. Next slide, please. All right, moving on to some of our modeling updates, some of the key takeaways to share with you today. In general, we continue to feel optimistic about the trends that we are seeing. We continue to see infections and hospitalizations go down, and projections anticipate that those declines will continue to occur in the weeks ahead. Modeling team is estimating that 1 in every 69 Coloradans was infectious as of February 13th. Keep in mind that is still a high number, certainly much higher than we want it to be, but we know we are heading in the right direction. Also very optimistic about this news in that most Coloradans, 90% of Coloradans are immune to Omicron at this point based on modeling projections, and most are also protected against severe disease. Vaccine and infection-acquired immunity will continue to fade over the months to come. We know that occurs. We see this trend of waning immunity and have seen that throughout the pandemic. But we estimate that immunity levels are going to remain high, at least until the start of the summer. Projecting beyond that gets much more challenging. But key unknowns continue to be the overall duration of immunity associated with Omicron. We're really not far enough out from this Omicron wave to fully understand duration of protection against previous Omicron infection or vaccination against Omicron. And then, of course, the big unknown continues to be the potential timing and characteristics of any future variants that could emerge. We know that this Omicron variant is probably not the last variant we are going to see, and unfortunately, we can't predict what the next variant might look like. Next slide, please. All right, so moving on to this projection. So this is actually the same projection from the end of last month, but what is overlaid here over last month's projection is the observed hospitalization data. So that is shown in that black line. So you can see the observed hospitalizations over time, and you can see we've seen that nice steady decline in hospitalizations. And then each of these colorful lines is showing you different potential scenarios with different changes in transmission control and what the modeling team projected we could potentially see now based on the modeling projections they did in late January. And what you'll see in this projection is that the observed hospitalization numbers, that black line, are tracking really closely with one of their projections, that orange line, which was associated with a modest 5% decrease in transmission control as we moved from January into early February. And so what that means is basically that there were some changes in transmission control. So probably some changes in individual behavior, maybe less mask use, individuals perhaps going out and about more, interacting with others, that has resulted in a little bit of a slowing in the decrease in the number of hospitalizations compared to the baseline scenario shown in blue. But in general, you can see that hospitalizations have obviously steeply decreased. And if you project all the way out to the end of February, you can see that we get to hospitalization numbers here around 250 or even below that, which takes us all the way back to those baseline levels that we saw last summer. So again, we'll continue to see this really steady decline based on these projections and hope to get back to those summer of 2021 levels in really just a couple of weeks. Next slide, please. Moving on to some of the estimations of the level of immunity currently in Colorado. So this figure is showing you the level of immunity against the Omicron variant specifically, and this figure shows you two different lines. One line is showing you immunity versus Omicron infection for all causes. So that would mean immunity developed from prior infection or immunity from vaccine combined. So that's shown in that teal or turquoise line. And then the orange line is showing you immunity versus Omicron infection just from vaccine. And what you see here is that we're at very high levels of immunity in the state right now. If you look at both combined immunity from infection and previous infection plus vaccination, you'll see that we're really right around that 90% mark with the proportion of the Coloradans that are currently immune to Omicron infection. That's obviously great news for us moving forward, meaning that we anticipate, the infection numbers to continue to decline over time. You'll see that you do see these numbers drift down over time. The projections in this figure go out to June, and you'll see that we do see that evidence of waning immunity from these projections, that we will see this slow decrease in the level of immunity over time. But all the way out to June, those immunity levels stay pretty high. Again, this is, of course, impacted by the potential for a new variant that resulted in more immune escape, would change this picture dramatically. But at least for now, these projections suggest that at least until June, if no new variant were to emerge, that we should be in a good place with the level of immunity in the state. Next slide. And then the news is even better if you look at immunity against severe infection. So that last figure was showing you immunity against all infection. This is a particular figure that is showing you immunity against severe infection or hospitalization, you could say. And so again, we see very high levels of immunity, even greater than what we saw in that last figure. So well above 90% of Coloradans, we believe, are immune to severe infection and should be until June, at least, as far out as these projections go. Again, cautioning that a new variant would certainly change the picture here if it had certain characteristics that result in our immune systems not being able to recognize that new variant. Next slide, please. And with that, I'll hand it over to Dr. Bookman.
All right, thank you, Dr. Herlihy, and thanks everybody for joining us this morning. The message of cautious optimism here continues, and on this slide, we see the orange line, which shows us the total number of hospital beds available in the state on that rolling 7-day average. The blue bars show us the total number of COVID hospitalizations each day. We started showing you this slide in the fall of 2021, where for the first time we saw that orange line go below the blue bars, meaning that we actually had less additional hospital beds available than COVID hospitalizations. Today, we show you this slide, and it is the first time since the fall where we actually have more beds available than we do have COVID hospitalization. So today on the rolling 7-day average, there are 872 acute care hospital beds available in the state of Colorado, and there are 641 people hospitalized with COVID in the state of Colorado. And so again, pretty significant increase in our hospital bed capacity as case rates and hospitalizations continue to move down quite dramatically. Next slide. So with that, as of this morning, the state of Colorado has been able to deactivate our crisis standards of care for both staffing and emergency medical services. They were both deactivated effective today. The staffing crisis standards of care were activated in November 9th of 2021, when we really began to see the significant stress on our healthcare system build in the Delta wave and in the subsequent Omicron wave. The emergency medical services crisis standards of care were implemented in early January of 2022, when we saw the significant impact of Omicron on the emergency medical services workforce. But we have reached a point today where those crisis standards of care are no longer necessary. But we do acknowledge that our hospitals have been under an enormous amount of stress, and want to thank, with just incredible gratitude, the work of our first responders and our healthcare providers over the course of this pandemic. We're at a point now where we can deactivate those crisis standards of care and see things return to a more normal state in our hospitals and in our pre-hospital setting. Next slide. And then a quick update on our continuing mask distribution program across the state. This is to provide free, high-quality medical grade masks at community locations across the state. We're up to 437 enrolled locations, and we have at this point distributed more than 4.1 million masks to keep Coloradans safe. And so this program continues for anybody who needs to get one of these free medical grade masks. They can go to our website, figure out where masks are being distributed in their community, and go ahead and pick them up so they have that tool at their disposal. Next slide. Brian, back to you.
Thank you, Director Bookman and Dr. Herlihy. We'll go ahead and move to the media Q&A portion of this morning's Media Avail. We can use that raise hand function. You can find that feature located along the bottom of the Zoom console. We'll stick with first questions first. If we have some time at the end, we can come back for follow-up questions or a second questions, time permitting. Please state your name and your outlet before asking your question. And if there's anything we're not able to get to today, please email us at media_info@state.co.us, and we'll get back to you as soon as we can. Let's go ahead and start with Alex Rose.
Good morning, and thanks as always for holding these briefings. Alex Rose here with Fox 31. You know, earlier, the modeling report that was released back in January, a month ago, said that by mid-February, where we are today, 80% of Coloradans would be immune. Now that number is up to 90%. I know some time has passed. We've collected more data, but could you, Dr. Herlihy, please explain, you know, what information we got that changed that projection all the way up to 90%? Thank you.
Yes, great question. I actually had a similar question when I saw the initial projections change. And so there's actually two primary reasons. One would be that the modeling team is constantly updating the model to account for the latest information that's available in the literature about duration of immunity, level of protection, those sorts of things. And so they're constantly changing that. So that's one of the reasons that value changed a little bit. But the other reason is that we also, if you remember in that figure I showed you with the projections, there was the blue line, which was their primary projection. And then there was the line I showed you that we were following, which was the orange line. That orange line showed a slowing in the decrease overall in the number of hospitalizations. So that slowing in the decrease means that we accumulated more hospitalizations and more cases, which then translates to greater level of immunity than their initial projection had suggested. So it's really a combination of factors.
Let's go to Meg Wingerter.
Hello, this is Meg from the Denver Post. I wanted to ask about, as cases and hospitalizations are expected to continue decreasing for the next few months, there's a lot of talk about kind of scaling back response or moving it more into the normal channels of getting tested and getting vaccinated at your doctors or what have you. So my question is, what is the status of the plan at this point to scale that back up if we were to see another variant and surge? How do we ensure we don't get caught flat-footed with that?
So, Meg, we have been responding to this pandemic now for almost 2 years. And we have built an enormous amount of capacity across our entire state. And that is, within the state unified command, within our local public health, our healthcare systems. And so, we continue to evaluate what the needs are at any given moment. We have seen periods of decreased disease rates throughout the waves of this pandemic. We will scale back our response appropriately during times of lower disease transmission and lower hospitalizations. We will work with our healthcare system partners to ensure that they are continuing to build their capacity for any future waves that we may see. But we also stand ready at the state to continue our response and scale to meet the demand.
All right, let's go to Vinny Del Giudice.
Good morning. This is Vinny Del Giudice at Bloomberg News in Denver. This is for Director Bookman. You say there are 872 acute care beds available versus 641 COVID patients in hospital. When was the last time something like this happened where you actually had the number of COVID patients lower than available beds? Are we going back to the early stages of the pandemic? Thank you very much.
Vinny, we'll need to get you the exact number and the exact date. But if you look at that graph that I showed, you're really looking sometime in mid-fall of 2021 when that orange line crossed that blue line. But our team will follow up with you on the exact date.
Thank you very much, sir.
All right, let's go to Sarah Flower.
Sarah Flower, KDUR, thanks so much for taking the call today. My question to you is the frustration and the message from the state to parents and those that are immunocompromised at this juncture, where there's so much good news, the frustrations in those that are ineligible to get vaccinated in this moment and those under 5 that cannot. Thank you.
Well, obviously, we were disappointed when the rollout on that vaccine for the youngest population was delayed. We are hopeful that there will be approval of that vaccine in the coming weeks to ensure that we can get vaccine into the arms of our youngest Coloradans. And we are at a point here where we're moving to a phase where disease rates are incredibly low. And we're going to have an opportunity here to move back into a more normal phase of living. And that's going to give an opportunity for people to make personal choices about the way they live during this phase of the pandemic.
All right, let's go to Mallory Anderson.
Hi, Mallory Anderson from KRDO here. What does this immunity mean for us? At the beginning of the pandemic, we heard a lot about needing to get to herd immunity. So some people might hear 90% immunity and will think that means that life goes back to normal. So could you just talk to us about what's realistic and what this means?
Yes, so I think the first thing to be aware of is that's obviously a state level estimate. We know that our communities are not uniform across the state. So we are going to have communities that have where there's pockets of lower vaccination rates or places where fewer infections occurred. And so the overall immunity level in certain communities is going to be less than it is in other parts of the state. The other thing I would say is that we know that certain individuals are likely to see greater waning immunity than other individuals. So there might be some settings like long-term care facilities, for instance, where immunity could wane faster or risk could be greater. And so, despite the fact that overall this news is very promising, high level of community level immunity, we still know that there are vulnerable people and that there can continue to be pockets of transmission and outbreaks that occur going forward. And strategies that we have used to protect vulnerable individuals will continue to be important.
All right, let's send it over to John Daly.
Hi there. Thanks so much for taking our questions today. I wonder, both of you have been part of the state's COVID response from the very start. I wonder if you could reflect on any big lessons learned at this point, two years in and now seeing these improving numbers? What would you say the big takeaways are from this?
Big question.
It is. That is a big question. Maybe I'll take a first stab at it, and then Rachel, maybe you can reflect on my reflections here. But I mean, first and foremost, the virus is unpredictable, and it has really been, leading the show here. And what I can say is that Coloradans have all come together to meet the challenges of this pandemic over the last 2 years. Our teams and teams broadly, across the state have scaled to meet the demands of this pandemic. We have, the 10th lowest death rate in the country. We've lost a lot of Coloradans, and we have seen enormous impacts on our healthcare system, on our schools. It has been an incredibly difficult 2 years, but I am incredibly proud of the way our entire state has come together to meet the challenges of the moment.
All right, and then let's go to Michael Daywana.
Yeah, hi. Thanks for taking my question. I want to ask this question on behalf of those who might be a little confused at this time because there's so much happening so quickly, and we've had, as we've seen the Delta wave, and then now the Omicron wave, and finally the numbers are going down. The mask restrictions have been lifted in many communities, Boulder most recently. But, I notice, and I'm sure everyone here has, that in many cases, including places like Denver, people continue to wear masks, which I'm sure is a good thing. But when people will see this information on the numbers continuing to come down, I'm sure they'll start asking that question, well, how much longer do I have to wear my mask? So I'm wondering if you could provide sort of information to the average person, what they should be doing right now in terms of masking. And then if you could, beyond that, just highlight a bit the places where masks will continue to be required. You mentioned just briefly their assisted living and nursing facilities. And so if you can just talk about the masking situation and address that, please. Thank you.
So I think we have a lot of empathy for the public who have been working with us on this over the last 2 years. And you're right to acknowledge the speed at which things are changing right now. The really dramatic decrease in cases, dramatic decrease in hospitalizations is moving us into a new phase of things here quickly. And so for those who have been working so hard over the last 2 years to follow all of the rules and to be in this with us, it is going to be a period of adjustment where we can move to a space where there is a lot less mask wearing. I think it's important that we show each other an enormous amount of respect for those who do continue to wear a mask. People may choose that for any number of different reasons, and I think we need to give them the space and the support to do that. There will be settings like healthcare and long-term care facilities and other congregate settings where we may see mask wearing a bit more enforced over the course of the pandemic, like you do sometimes in flu season in a hospital. But for now, we are going to see I think less and less masks out there as disease rates go down, and we do need to continue to give space and respect for those who continue to wear their masks.
All right, do we have any other first questions in the room today? All right, let's go back to Benny.
Are you calling on me? I'm sorry, you cut off.
Yes, I am. Apologies, Vinny. Go for it.
That's okay. Yeah, hi. Again, this is Vinny Del Giudice at Bloomberg in Denver. What what would you say, and I'm sure they're out there, what would you say to people that say, whoa, you're moving too fast, we have to be careful still with all these restrictions, masks and everything like that? A lot of people don't like them. A lot of people are happy they're gone. But what do you say to people that say, and you're moving too fast, we don't know where this thing's still going? Thank you very much.
Well, I think that's why our message is one of cautious optimism. It is why we are continuing to tell people that today disease rates are still quite high. Our new schools guidance doesn't go into effect until the end of the month because we do believe that we're going to need that period of time for disease rates to continue to come down. And so we do acknowledge that this is moving quickly, but the virus is moving quickly as well. And we need to make sure that we are moving at the pace that is required while continuing to have that cautious optimism and that caution part of it so that we are prepared if there is a new variant. We have our surveillance systems that will be in place. And while we may scale the response back because the need will not be there, we will be prepared to scale back up as needed to meet what future demands might be.
Thank you again. Thank you very much.
All right, let's go to John Frank.
Dr. Bookman, John Frank here from Axios. Given what you just said about masks a moment earlier, are you still recommending people wear them in indoor settings like you have in previous weeks?
So again, we're moving to a spot of personal choice coming up in, I think into March. As I said, we still see high rates of disease, though coming down pretty dramatically. And I mean, I'm still going to wear a mask when I go into the grocery store. To me, that is the choice that I am going to make to keep myself and my family safe. And I think we will continue to recommend that people make the choice that is best for them, best for their family. For those who are all up to date on their vaccine in their household, I think we're reaching a point where they are going to be able to go back to living their lives with a bit more normalcy. For those who have vulnerable people in their home, for people who work with vulnerable populations, we may still need to see more precaution in those groups. But things are changing rapidly, and there is a lot of promise in the future here, and we just need to work together as we get there.
So just a quick follow-up. I can say that you're no longer wearing masks in indoor spaces like you have in previous weeks. Is that right?
As of today, we continue to recommend that people wear masks when they are indoors. But again, local jurisdictions have made decisions about mask mandates and support the local decision-making. And we are definitely moving into a period where even indoor mask use will begin to wane over time.
All right, let's go to Virgie Pivot.
Thank you, Brian, and thank you everyone for hosting this briefing. Virginia Pivic from 9 Health and freelance reporter. Speaking of vulnerability, immunity dropping towards June 2022, as we saw in the graphics, and potential new variants coming our way, are we considering a fourth booster? Thank you.
I can start. So we would certainly be looking for federal guidance on that. So we would be looking to FDA, ACIP, which is part of CDC recommendations on whether additional boosters or new vaccines might be needed in the future.
All right, let's go back to John Daly.
I guess a little bit of follow up on my earlier question, and I guess this would be for Dr. Herlihy. When you look back over the last 2 years of the pandemic, what has proven most surprising to you in terms of this virus?
Yeah, so I mean, I think the unpredictable nature of the virus and the emergence of variants that have had, changing characteristics. The Omicron variant, I think in particular, with the really, significantly increased level of transmissibility associated with that, and how, coming off of a large Delta wave here in Colorado, just as we were starting to see things improve here, we saw this again, another large wave of illness that occurred. And looking back at some of those figures I was sharing with you, if you look back over the last couple of months, we've really been in high levels of transmission since August. And so I think that's been a little bit unexpected to have these sort of back-to-back waves occurring. And I think similar to Scott, I, of course, am feeling cautiously optimistic about what is to come. But as I said in the beginning of this answer, we know the virus is unpredictable. And so I am certainly going to be watching the virus as it is evolving on the international scale to see if there are new variants or subvariants emerging, and trying to understand what those could potentially mean for us over the next couple of months. So, certainly watching the data closely, feeling optimistic, but also feeling cautious.
All right. Thank you, everyone, for joining us this morning. Thank you, Dr. Herlihy and Director Bookman, for your participation with us this morning. If you have any questions that we weren't able to get to or that were not covered on this morning's Media Avail, please email us at media_info@state.co.us. Thanks again for your patience up top. Have a good rest of your day.